Welcome to the Rehab Links Secrets to Success podcast. I'm your host, Lisa Chase, and I would love to welcome Dr. Mara Kevan on our show today. Welcome, Mara.
Hi, Lisa. Thank you so much for having me.
Well, thanks for coming. I really appreciate it. So, a little bit about Mara. She's actually one of my healthcare practitioners. Her and I met in the community, right? We met, I was trying to remember how we met, but I think it was really in the community.
Through Dr. Cole, we came and did a
Yes,
co-presentation at
that's right.
Back to Normal Physical Therapy at your
That's right.
practice
That's right. It's when you were
4
working.
years ago.
That's right. I know. That's right. So we were working together, just through that connection. And then, I sought you out as one of my healthcare providers. So you are a primary care physician specializing in traditional Chinese medicine and a board certified acupuncturist. You have such a great background and you've got a practice, right, called Mar Acupuncture and Medical Center right here in St. Petersburg. So we're literally just a couple blocks from each other.
Yes.
Yeah,
Yeah. It's so nice that we are so close to each other.
yeah, it really is. And I love having alternative medicine practitioners and where you and I can collaborate on patients. So why don't we just start with you giving us a little background about who you are and how you came, into the field and how you started your practice.
Okay, well, thank you. I always knew I was going to go into medicine. I did my pre-med studies at the University of Vermont. I just didn't know which field I was going to go into. And so I wound up going into the family business, which was travel management for the rock and roll industry. And while I was doing this travel management, which required me to travel around the world, and it was very demanding, my low back went into spasm. And my aunt, who I worked for, she was the travel director of the company, said, "You have to go to my acupuncturist slash chiropractor." And I said, "I have no idea what either of those things mean, but I'm willing to do anything because I'm laid up and I can't move and I can't work and I'm in debilitating pain." So I went to this double board certified doctor in New York City. To this day, I'm still in touch with him. He's a mentor of mine. I say that he lit my light bulb. So with my first visit, he had me laying face up on the table. And I thought, what is this wackiness? My back is over here. Why am I face up on the table? After that first visit, I felt better. Within 3 visits, I was back on the road and touring and doing my job as though nothing had happened. And literally, that was my light bulb. My calling went off, and I went, "This is the most brilliant medicine I've ever experienced. How can somebody be healed so quickly and so affordably?"
Yeah.
And within 2 months of that, I asked that doctor to write a letter of recommendation for me to go to Chinese medical school, and I started in Manhattan. And here we are, gosh, almost 20 years later. So I say that this is my love story. Not only did the medicine heal me, but it is an honor that I get to then pass this forward and help support people who are doing the hard work. People thank me, and I say, "I'm just here to support you. You're the ones doing the hard work." And Chinese medicine is the vehicle to help get you to your goal.
Yeah, it is super powerful. And I think especially when you have a personal experience, where you have pain or you've had an illness, and then you work with a practitioner that just changes your life, right? Because when you're in pain, you will do anything to get out of it. And I have experienced obviously acupuncture with you, and I have other practitioners that I've worked with over the years. And it's just a great adjunct, right,
Mhm.
to so
Yes.
many other things that we do. So
Yes.
tell us a little bit about your practice and how you're serving the community in St. Petersburg.
So my practice is in downtown St. Pete, and I have a custom built out space that I had a feng shui specialist come in and design. So it feels very much like you're walking into your living room and your home. Every room is custom designed and has a different energy and feel. So people get to choose which room is calling to them. We have big windows with lots of light. We have a little cozy room that's more like a nest. And it's very warm and welcoming. I have people ask if I live there when they first come in. And I'm like, yes, this is the goal. I want you to feel like you're in a home, that it's really warm. And I call it the sanctuary. It is a sacred space for people to come and feel safe and to heal. I have an amazing office manager who is also very connected to the patients, and I am currently onboarding some new practitioners, which is really exciting because I don't have all the tools in my kit, and I love to collaborate with others, such as yourself, and massage therapists, and chiropractors, and neurologists, and orthopedic surgeons. The list goes on of how we can support the patient through collaboration and helping them get optimal wellness. My main specialty, I started in fertility in San Francisco. I did a 2-year externship in an ABORM certified clinic, which is the American Board of Oriental Reproductive Medicine, which requires its own extra medical board passing to be ABORM certified. And then I wound up moving to Oregon, where I actually transitioned from fertility. And everyone thinks this is so bizarre. I transferred into oncology. And they thought, how did you go from fertility to oncology?
Right.
And really, pathologically, it's very similar. I'm either turning a gene off or I'm turning a gene on,
Oh,
right?
yeah.
So I helped develop an integrative therapies department inside of the St. Charles Cancer Center in Bend, Oregon, which to this day is so successful. There's now a 3-month wait list for people to receive acupuncture, Reiki, and massage at no cost to the patient. It's all grant funded.
Mm.
And so I then went on and I did extra training with an oncologist in Germany and in Israel to get my oncology certification. So it's very near and dear to my heart to work with cancer survivors who have now been discharged from care but need continued support, as well as someone who has just recently been diagnosed and is currently undergoing treatment. And then the other focus of my practice are veterans. I started working with veterans when I was in my medical schooling, and there are stories that I have that I still tear up about 15 years later of the success stories of certain veterans. There was a couple we treated at the clinic in San Jose, California. He was a Vietnam veteran who had not slept in over 30 years at that point. He woke every single night with night terrors. And because of his PTSD and him not sleeping through the night, his wife never slept through the night. And so for 30 years, the two of them
Mm.
had been really in survival mode, and they were not connected. They were not close. She was in almost like a fibromyalgia type pain just from not ever healing through quality sleep at night. After a few treatments, he slept through the night. She came in crying. I mean, she was crying. I said, "Oh my gosh, what happened?" And she said, "He slept through the night and I slept through the night."
I
And they were holding hands. She wasn't having that
know.
pain that he could put his arm around her. And I was like, that's it. I'm definitely working with veterans for the rest of my life. So I am in network with the VA's Community Care Network, where we provide free acupuncture to any veteran, whether they're currently in active duty or if they are retired, and it is at no cost to the veteran. The VA Community Care Network reimburses me for my services.
Oh,
So that is a huge honor to go from 15 years ago in San Jose, California, in my teaching clinic to here in St. Petersburg, Florida, in my own practice, to be continuing to help support veterans through their care.
wow. That's so impactful.
Mhm.
That's so great.
Yeah.
I know acupuncture and, Chinese medicine has been around for many, many years, but
A
I
few
think,
thousand. A few,
2000.
a few thousand.
Few thousand. But some of our listeners might not really understand really what acupuncture is and Chinese medicine and how it is used to help heal the body. So maybe let's just talk for a moment about that because I do dry needling.
Yes.
And oftentimes I ask people like, have you ever had acupuncture, or do you understand it? And they
Mhm.
really don't understand how it works. And so I'd love for you to share with our listeners, how it works with the body and healing.
Yeah, it's really weird, right? Our moms taught us not to run with scissors in their hands, and here I am spitting needles at people, and somehow they feel better afterwards, right? So The way acupuncture works is we have main organs in our body, like the stomach, the spleen, the lung, the heart, the large intestine. Each of those organs has a corresponding meridian. It's like an invisible little highway that runs around the body. Each of these invisible highways, meridians, has a start and end point somewhere on the body. Along that highway, we have something called acupuncture points, where there's an increased concentration of blood, oxygen, and what we call chi in the body. Chi is our life force. It is something that we all embody. The computer has chi. Your hair has chi, your dog has chi, the wind has chi. And you can explain this like if you walk into a room that has been shut up for like the winter and then you go open a window and all this fresh air comes in, that's chi, right?
Mm,
That's a free flow of energy. It's how you can explain that you go sit next to somebody and you want to move closer or you want to move further away. And you
right.
can't explain why because you haven't even spoken to them yet. That's chi.
Yes.
The way trigger therapy works of what you do is, or the dry needling works as a trigger therapy, right? We have these concentration of tightly bound little fascia areas in the body. This is how we diagnose fibromyalgia, is these 18 points around the body. And we can stick a needle into that tightly bound fascia, which is our connective tissue network. It allows your shoulder to do this, holds our organs in place, and you release that point, and it's like, letting the air out of a balloon and that tension goes. And that's where dry needling is so acute and perfect for chronic aches, pains, or even an acute ache or pain.
Yes.
So we can place needles in these acupuncture points, and I choose what I call my point prescription based on somebody's unique symptoms. So each acupuncture point has its own pathology and physiological indications. So we could treat hot flashes, we can treat insomnia, we can treat anxiety, we can treat high blood pressure, we can treat tinnitus in the ears, we can treat chronic neck pain, back pain, knee pain. All of these points are helping create a free flow of blood in the body.
Mm,
Blood is what carries our nutrients and it's what expedites healing. So the more we create free flow, the more the body works. If we don't have blood flowing in the body, nothing's going to work, right? The heart's going to stop. You're going to have a limb cut off. So it's really important that we create this natural perfusion throughout the body. And through the process of doing these acupuncture points, we also are tapping into our parasympathetic nervous system. We have two nervous systems, the sympathetic, which is our fight, flight, get up, go, have energy, and then our parasympathetic, which is quiet, sleep, relaxation, digestion. And acupuncture taps into that parasympathetic nervous system. So we feel really calm, really relaxed, really loosey goosey. I call it being in a state of acuphoria when you get up off the table. I love it. People come into the practice and they're all like this. And then when they walk out of the treatment room, they're like,
ah.
they're floating. They don't
Floating.
know
Yeah,
their
yes.
name. They're smiling.
Yes.
Every person reports lower pain levels and a happier mood. And I'm like, wonderful. All right, that's our goal. Stress is such a deleterious component to our day-to-day life, and we need to counter that, and we can stave off the activation of dormant disease cells by tapping into our parasympathetic nervous system. And acupuncture is brilliant at that as a preventive medical care. People say to me, like, I'm really healthy. I'm not on any medications. I don't really have any chronic aches or pains. Knock on wood. Thank goodness. Why would I come to you? I say, why would you want to develop those things?
Yes.
Right.
The
So through that
preventative.
aging process, we want to do preventive care and we want to stay younger than what our numerical age is. The other brilliant thing is that now with modern day medicine is that we can put someone's brain inside, well, their head with their brain inside of an MRI. And let's say we put an acupuncture point in the top of their hand here.
Mhm.
We can see in a direct correlation in the brain on the MRI imaging result an increased volume of oxygen and blood flow to that
Wow.
particular area. And we know because of neurological brain mapping exactly what that area of the brain has a function and indication to do. And
Wow.
so, perfect example is cancer patients who are going through chemo and radiation. They might have a saliva change in their mouth, whether they have lack of, which is xerostomia, or they have an excessive amount. There are always changes to that. So I can place a needle here in the top of the hand. We can see the increased blood flow to the part of the brain that tells the salivary glands to release more saliva.
Wow.
And then the patient reports, I actually have more saliva in my mouth. And then these case studies have shown they measure it by them kind of sucking on a cotton ball before and after, and they can measure how much liquid they get from the saliva before and after the acupuncture needle was put in.
Wow.
So modern day evidence-based medicine with diagnostic imaging through MRIs, we can actually prove what a 3,000-year-old ancient healing art innately knew what to do with the body. So our body has an innate immune system, an innate ability, meaning to heal itself. We
Yeah.
just need to tap into it.
Yeah, and I mean, and I, can attest to that because I come in for your Serenity Saturdays, which I
Yes.
just absolutely love. Once, I started feeling better, then, now I like to just come in, whether it's once a month or, a couple times a month, just depends, just to kind of get that boost of, parasympathetic reset of my
Yes.
autonomic nervous system. Yeah, I go floating out of there. I love it.
I love that. It makes me so happy. Yeah. And this is where you fall into that maintenance category and preventive category. You've invested so much to feel optimal the way you are right now. Let's not undo it, right? Is what I say to people. So let's then have you come in once a month or even once a quarter, right? And then if something acute pops up, we get you back in, new treatment plan, and then we wean you back down again. I tell people, I love that you're here, but I don't want you to be here. I want you to be out
Right.
there living your life. And so my goal is treat the symptoms, and I treat the root, not actually the symptoms. I draw everything back to determine what's causing those symptoms. Once we treat the root, those branches go away. And then we can wean you out and you're out living your life and doing the things you really
Yes.
enjoy doing.
And that is just so true, because so many people come in with symptoms, and where their symptoms are isn't necessarily the root cause. And, that's going to kind of lead me into the next,
Mhm.
segue, which is, how, you get great outcomes. And so now let's kind of shift to your kind of three, pearls that you
Mhm.
have, that you have found over the years has really impacted the outcome of your patients?
Number one is time.
Mm,
Spending time with my patients.
yes,
And unfortunately, modern day medicine, there are not enough practitioners, from nurses to doctors, to spend the amount of time that they would like to and need to be spending with their patients. And so there isn't comprehensive care happening inside of a hospital setting, whereas in a private practice setting, we get to control the amount of time we spend with somebody. And so I spend a lot of time with people. My initial intake is an hour long, and people thank me. They're like,
yes,
wow, I have never had such comprehensive time. I'm actually treating an MD right now who is a pediatrician, and he's just, his like eyes are doing this every time we talk, and I'm like, how am I teaching you this information, right? And he's taking these pearls back with him.
yeah,
So time is my number one pearl, is we
that's
all need
so
to be
true.
taking more time for ourselves. We need to be slowing the clock. We are so busy. We are little hamsters on the wheel
Yes,
all the time. We drive in cars at 80 miles an hour. We have up to a million things to do a day. And we need to really start to prioritize time for our loved ones, time for ourselves, which is self care, and then choosing people who are going to give us their time when we go seek care with them. Means we're listening, right? That's number one pearl. Number two pearl, food is medicine.
mm,
Hands down, I can do all the acupuncture on the planet. I can do all the Chinese herbs on the planet. I can do all the supplements on the planet. I can run every lab test under the sun and interpret it as fine point functional medicinally. But if we're not looking at food as medicine, it's all a band aid. And so I spend a lot of time providing customized food as medicine recommendations to my patients. So not one size fits all in Chinese medicine. We are different sexes, we are different ages, we have different physical outputs, we have different mental outputs, we have different goals. And so everything gets customized to the individual. I love doing cleanse programs. I'm currently on a 10-day right now that I do every single fall. And the first time I had my mom do this, I customized it differently for her than how I was doing it.
yeah,
And so I don't think we should all be fitting into one little box, and modern day society says we should all fit into a box, and we
Right.
don't, and that's what's frustrating. So I do a lot of guidance, and then I do, again, a lot of collaboration, like the nutritionist in your place, and I also work with nutritionists in other places, because I can do so much, but then I really need to reinforce that food is medicine component through the care of a nutritionist who's going to carry on what I've kind of put into or laid the roadmap down for.
Right.
Um, my third one is stress management.
Mm,
And going back to the root of something, I can draw pretty much 99% of every single ailment we have, whether it's internal medicine, orthopedic medicine, neurological, that the activation of that ailment is because of a stressor.
yes.
And this is probably the biggest subject to try and manage because it's what's going on out there is never going to go away.
Mm,
Driving at 80 miles an hour is not going to go away. Rushing through an airport and being late for your plane is never going to go away. Trying to rush your three kids to three different schools because they're three different ages is never going to go away. Now, in the age of we have kids and parents we're taking care of, we're sandwiched, right? This is the sandwich generation of caring for two generations. It's not going to stop. So, again, I'm going to go back to the first one of time
mhm.
and then self-care and stress management. And stress management comes in all kinds of forms. It can be coming actually to physical therapy and getting some nutrition guidance within your place. It can be going for a walk on the beach at sunset. And I mean strolling,
Yeah.
not power walking,
Power walking.
strolling, picking up things from nature while you're out there, picking up rocks and shells and holding them, putting your feet in the water and touching Mother Nature. It's very clear to me. So I want to go back to the meridian component we were talking about before. Our kidney meridian starts in the soles of our feet, right at the balls of our feet. And in Chinese medicine, we are given something called our prenatal chi. This is the chi that is God given to us by both of our parents.
Mm,
And this creates our uniqueness. And it is not surprising to me that our soul of our prenatal chi, our kidneys, starts in the soles of our feet,
mm.
right? So it's so important that we walk in Mother Nature, in the sand, in the grass, in the dirt, and really connect and ground. That alone will lower our blood pressure and decrease our stress. Meditation is beautiful. You can find guided meditations anywhere online. You can go to guided meditation workshops. There are now opportunities that people can really start to learn how to meditate on their own. And it has been proven empirically that meditating lowers our blood pressure, lowers our anxiety, decreases stress, decreases the incidence of heart attacks and strokes, and decreases the incidence of, again, activating dormant disease cells. I never feel more grounded than when I am sitting outside quietly in nature, even if it's for a few minutes, right?
Yeah, those are all three really
Mhm,
great tips and
mhm,
absolutely, several things that I apply and I, believe in, giving patients time.
mhm,
I love how you said, not only ourselves, right?
mhm,
But then, to take care of ourselves, but also to take care of our patients because
mhm,
healthcare, unfortunately, is not going in the right direction. I mean, even I have experienced this in going to healthcare providers, and I'm just like, wow,
right,
what has happened to healthcare? Because, 20 years ago, you could go in and speak to a primary care and they would take that time.
right.
But it has fast tracked in a way that it really doesn't, take care of the patient. So
I
I love
think
that.
I think there will be a new field. I hope there's going to be a new field that people want to enter into, and it's patient advocacy.
Yes.
Because I feel very blessed to be in the field that I'm in, that I can support my mom in her natural sinensis process. And I, like you, have experienced this Western medical paradigm with my mom that if I weren't there to advocate for her, wow,
I
I don't know what honestly, I actually do know what would have
Yes.
happened, and it would have been deleterious to her health and her livelihood and her longevity. And it made me so shocked, in awe, that if I weren't there, and I think about all the people who don't speak English as a first language, who
Um,
have 5 kids, who are working 3 jobs, who just don't have the ability to self-advocate, and it makes my heart break.
All right. Well, I know that you are a professor and that you're teaching, right? And you're teaching Chinese medicine, correct?
I'm teaching US healthcare systems at a Chinese medical school at PCOM, New York.
Okay.
So I don't teach Chinese medical courses right now. I hope
Okay.
to. I'm actually hoping to start teaching at one of the schools here.
Okay.
The US healthcare system is really learning about how our healthcare system operates. And I think it's the course that scares the medical students more than any other
Uh,
course, because of really learning about the finances and how we
uh,
spend more per year than the average GDP of most countries.
Wow. Well, I know that, that you still, whether you teach your patients, I know you've taught in the past, what would you say are things that your audience really appreciates, whether it be your approach, um, how you maybe position things, like what would you say is something that they really appreciate?
I'm very interactive and I love to do group work. And so I like to bring in modern kind of examples of stimulus and then how we can apply both Western medicine and Eastern medicine to something that is a national, what I would call pandemic. Perfect example is a documentary on homelessness and how to provide healthcare on the streets and how to provide quality healthcare on the streets to individuals who are disenfranchised from the average healthcare system setting. And it's complex, right? There's safety issues involved. Are women as practitioners safe to go on the streets? Especially in larger cities, right? So we talk about the racial component, the sex component, the religious component, and how to provide healthcare to the disenfranchised. So that's one example. And these are things that most of us don't think about on a daily basis. So it's
Right.
very collaborative, very interactive. And that's how I am in my practice. I'm very collaborative and I'm very interactive. I say, I am going to learn as much from you as I hope to share with you also. The little pearls of wisdom that I get from my patients and colleagues, I then pass on to other patients and colleagues as well.
Right. That's so true. I feel like I was thinking about that the other day. I had a complex patient and I was thinking to myself, I learn every day from my patients. They come in
Mhm.
with things sometimes that are very complex or things maybe that you haven't heard of. And it just pushes you, to really learn and expand and try to figure out how you can help people. So, yeah, being interactive is really
Mhm.
is a key, right? Especially like we were talking about in healthcare today. I think now more than ever,
Right.
patients are craving that for sure. So, is there anything of value that you would like to give to our audience?
I think the biggest takeaway that I want people to understand about Chinese medicine is that it is about tapping into your body's innate ability to heal, and that every treatment is customized to the individual.
Mm.
And it's about preventive care. And this fills in the gaps where Western medicine is brilliant at acute trauma. I mean, brilliant. If you have blood coming out of your ear and a bone sticking out of your skin,
Right.
your Western medical doctor is going to be brilliant at helping you with
Yes.
that. And then go to your Chinese medical doctor.
That's right. Yeah, and it's also very complimentary. Like, like I know that you have plenty of patients that are under regular medical care and they need to do that, but this complements and it can accelerate the healing in so many ways. And then I think for our patients that aren't getting the results, right? Maybe that there are those complexities. Like you said, there are other things like stress, sleep, nutrition that may not be that I know is not being addressed right in the
Right.
traditional care model. And so that is something that this kind of, medicine is really powerful.
Yes. Yes.
Sure. Well, how can people find you if they want to learn more about you?
They can go to my website, which is maracupuncture.com. So the name of the practice is Mar Acupuncture, which is the Spanish word for sea. So it's the sea of chi is the meaning behind it. So we create a free flow of chi, just like the sea has free flow. So it's maracupuncture.com, or they can call the clinic at 727-677-8006.
Well, wonderful. Well, I would highly recommend anybody in St. Pete go check it out, even if it's for Serenity Saturday. Treat
Thank you.
yourself. It's wonderful. You're wonderful. I love having you in the community and being able to collaborate together. And thank you for all that you do. And thanks for sharing your knowledge with us today.
The last pearl of saying, everyone just wants to be understood. They want to be acknowledged and they want to be loved. And this is where I come in and I support all three of those things with people, and then getting to collaborate with individuals like you. I get to have the honor of providing optimal wellness. So thank you, Lisa, for having me today. This has been amazing.
Awesome. This is great. Thanks so much.
You're welcome. See you soon. Take care. Bye.